Good day, everyone, and welcome back to Women Incorporated. Today, we have with us Dr. Kasturi Bhattacharjee, who is a globally renowned ophthalmologist with a distinguished career in the field of eye care. She is the only doctor in the field of eye care from the Northeast India to have a double FRCS and an alumnus of the prestigious Harvard Medical School. She is currently the director of Sri Shankardeva Netralaya. Good evening, Dr. Kasturi. It's an honor to have you on my show today.
Hi, it's an absolute pleasure meeting you here.
How's your day been so far?
The day, if you ask me, I feel it's very interesting. It happens to be a very busy day today, but equally fulfilling. Like morning started with the patient care, then I was in some other meetings, and now I'm with you.
Oh, that's great. A busy day.
Yeah, I should say so.
I'm sure that's your regular, routine, correct?
Exactly, yeah. It's like along with patient care, so much other administrative work also to take care of it.
Right. Dr. Kasturi, could you share with my audience a bit about your early childhood and family?
Yeah, I was born in Guwahati, born and brought up at Guwahati. I come from a very humble family, a family full of love, warmth, and also a family which has really taught me about the good values of life.
Okay.
My dad happens to be like, he's no more here, but he was a professor in Assam Agriculture University Veterinary College.
Oh.
And my mom was also working mother.
Okay.
Like she was a program executive in
Alright.
All India Radio.
Okay.
So both my mom and my dad, like ma and dad always like, they taught us, they made us realize how like importance that whatever you do, you should be really dedicated, really passionate, and also do with best honesty.
Right.
But very interestingly, both parents are of different nature.
Okay.
My dad is very fun loving, he's into sports, and he had always made us realize the importance of health.
Right.
For him, wealth is only health. But my mom, who always says that the best wealth is knowledge. So from both of them, I realized today that the best wealth for all of us is basically health and knowledge.
Okay.
And I come from a family where I have got 3 siblings.
Okay.
2 sisters and a brother. The elder sister, she is a postdoc and working as a professor in a veterinary college. The second being head of the Department of Nephrology at Guwahati Medical College.
Okay.
And my brother, who is the Chief Technical Officer of FEMA, and my sister-in-law is the Superintendent Engineer in Pollution Control Board.
Okay.
So this is about my family.
Right.
And then in 1994, I got married to Dr. Harsha Bhattacharjee. He is my husband.
Okay.
Today he is the president of this institute.
Okay.
And that is in the first year of my residency program when I had started doing my MS in ophthalmology. And then in the first year, I gave birth to my first daughter.
Okay.
And then in 96, I gave birth to my second daughter.
Oh, wow.
So I'm the mother of 2
beautiful daughters.
Yeah.
That's nice, so sweet. Dr. Kasturi, during your course of education, what actually inspired you to specialize in ophthalmology?
That's a very beautiful question, I should say, because I always believe that the eye is not only the gateway to the soul, but it is a gateway to the diagnosis of not only the diseases related to the eye, but also diseases related to many systemic diseases, whether it is hypertension, whether it is diabetes, or also something like rheumatoid arthritis. Like all these diseases manifest in the eye. So when I was in my residency program and when I have seen the eye for the first time, I realized how beautiful it is. Like we have a very important layer of the eye which is a nerve layer, and this is known as retina. So this retina, which looks exactly like the sun, like when we look at the sun, the sunrise, and that is how the eye looks. So this really fascinated me, and this is the only layer where you can see all the important structures, like you can see the blood vessels, you can see the cells within the blood vessel. Like if you look to the skin, we do not see underneath the skin. But in eye, you get a chance to see how the blood vessels or how the blood is moving, you get to see how your nerves are working. So that is how it has really fascinated me.
Correct. Apart from you being the director of Sri Shankardeva Netralaya currently, what else are you up to these days?
You know, that's yeah. We have in all India, we all eye doctors are known as ophthalmologists.
Right.
So we have a All India Ophthalmological Society where there are 27,000 ophthalmologists, and one of the very important association or the body of this organization is the Academic and Research. So today I am a member of this very prestigious Academic and Research Committee of All India Ophthalmology. That is number one. And also we have a subspecialty which is known as Oculoplastics Association of India, where we do all the plastic work of the face. I'm the chairman scientific committee, that is the scientific program coordinator of this Oculoplastics Association of India. And you know, very recently, like we have a another big body which is the Asia Pacific body of ophthalmic plastic and reconstructive surgery, and very recently we had the annual conference in Chengdu, China. So there I was elected as the president-elect.
Wow.
So these are some of my academic and my research related organizations where I'm involved.
Right.
Besides that, I'm also very much into publication, into research. So today I'm in the editorial board of the Indian Journal of Ophthalmology, also in the editorial board of the prestigious American Academy of Ophthalmology INET magazine. So these are something which are related to my, I should say, academy and research. But over here in this institute, one of my biggest passion is doing surgery. So I do basically cataract surgery, refractive surgery, like the LASIK surgery. You see many children, they come with glasses, without glasses they don't see. This is known as a myopia. So you do a laser surgery which is known as a LASIK, and they can get rid of the glasses. And more than that, we have a very big oculofacial aesthetic department. We do lots of other aesthetic procedures which are associated with the periocular rejuvenation. And you can see this is my aesthetic clinic itself, and it's so wonderful to have you here today.
Yeah, and it's really nice. Your setup is also extremely
Thank you so
beautiful.
much.
Dr. Kasturi, I have to say this, you are a postgraduate from the Harvard Medical School, and how was the experience like over there?
Like after joining MBBS and after taking up my master's program in ophthalmology, so I have become a clinician, then I should say I became a surgeon, then I became a researcher. But in 2019, I have become the director of this institution. Then I have realized that I need to train myself in administration, in management, in leadership. So that is how I have decided that I should do some management program, because I always believe that to run a big institution, you should have ample knowledge how to run it. Because I do not think that leadership is something which person comes, like leadership is not something born with that with the quality. It is not in the genetic code. Leadership is something which makes you a leader. So that is how when I was going through the different programs, and luckily I got enrolled in this leadership program in Harvard Medical School. And in this program, the best thing I came to meet some of the brightest mind in my field and also in the field of the management. So that is how when I was doing in this program is very interesting, because they teach you not only leadership, they teach you about innovation, communication, which is so important, and also they teach you about the quality. And the most important is finance. I always used to love maths when I was in the school days. So here I go to my mathematical mathematical knowledge, whatever little I had. So there is a very interesting program on hospital finance. And then like there were approximately 60 plus students in my batch, and it's divided into multiple teams, and I was in team 6, and we are supposed to present the different assignments related to finance, and I was a team leader, interestingly. And when I presented it and on the finance, and our team got the best finance award. So this is a very interesting program which has really helped me open my eyes to work with both my soul and my head, I should say.
It also upgrades the skills.
Yeah, it has really upgraded my skills, and to take a very important decision, and also some good work, not only for my hospital, how to give back to the community. My parents always used to say that whatever each one of us, like you, me, whatever we are today, it is because we have got from the community.
Yes.
So it is a responsibility for each one of us to give back to the community.
Correct.
So now also I'm really developing the community program, the program to reach the unreached, to reach the last man in the last mile. How can we give them or prevent sight, like give them sight and prevent the avoidable blindness?
Okay, that's quite interesting. Dr. Kasturi, also, I would want to know a couple of things. Like, you have received more than 50 national and international awards. I'm sure there are a few which are dear to you. Could you name some of them?
Yeah, definitely. You say that, as I have already mentioned, we have a very big organization, All India Ophthalmological Society. So there are three very big prestigious, I should say prestigious award. One is Colonel Rangachari, one is C.S. Rashmi, and the third one is E.T. Sulum.
Okay.
And I'm very happy to share with you, like with all humility I'm sharing with you, that I'm the only lady ophthalmologist of India to receive all the three prestigious awards from All India Ophthalmological Society. Besides that, like I'm also, as I have already mentioned, I'm very passionate in my surgery. And I have developed a very innovative surgery for those type of patients, like especially you see like all these children nowadays, they will, ride the motorbike without any helmet and they get injury here, there, and there is condition known as traumatic optic neuropathy, wherein because of very trivial injury near the head or around the eye, they go for total loss of vision. So that was something really affecting me, and I really want to help these children because when they lose the vision, the first, physician they come is the ophthalmologist. So then I thought, how do we reach that nerve which is so near to the brain? So I have developed a very innovative surgical technique with the use of a GPS system which is known as navigation. And this is known as a navigation guided surgical technique for optic canal decompression, for which I have also received an international award. This is Asia Pacific in the best paper in one of the sessions. And also very recently, this my surgical technique got published in a very prestigious journal which is known as the British Journal of Ophthalmology. So besides that, I have also received some grants and also awards by the highest research body for us, that is the ARVO, this American body. So I am one of the few, I think, Indians to have received that. So
I know there are quite a few, I'm sure, and these are the very ones that are very close to your heart, I'm sure. And I'm sure you must be feeling proud to, share it with all of us.
Actually, I'm very thankful, like the help, support, cooperation of my friends, my family, the community. That is what I like to mention.
You have been very successful in your career till date. Any challenges that came along, and how did you overcome them?
I feel challenges are inherent in every journey. And I feel that all of us, we get lots of obstacles in a journey. But what I believe, that all obstacle we should try to convert into an opportunity. Yes, it is very true. Like, life is not a bed of roses. All of us have, whenever we try to climb the ladder higher, so many obstacles. But yes, it is not so easy. And what people usually see, like they see only the bright hummock. Like when they look something, they see the tip of the iceberg. They see only the success. What people do not see is the darker side of it, which is inside that iceberg. Below the iceberg. The obstacle, the hardship, the perseverance, the failures. So everyone definitely gets lots of obstacle. Even I have gone through. But I took all obstacle as an opportunity, and I tried my best to stay positive and overcome all these challenges.
That's quite inspiring, Dr. Kasturi. On the social side, what's your take on women empowerment?
For me, if you ask me women empowerment, I would say that to provide equal opportunity and also to provide equal resources. But the most important is to provide the same respect to a man and a woman. Like if you look to any organization structure internationally, you will see that most of the women are stuck at the base of the pyramid, and for a woman to climb to the top position of an organization, they need to break this glass ceiling, which is an invisible, I should say, metaphor. But I feel in many organizations it is much easier for the male, but for a female, we need to prove ourselves. So that is very important. So I feel that all women should be given, every woman in the society, equal resources, equal opportunity, equal amount of respect, and the most important, beside a man supporting a woman, I also like to say every woman should also support a second woman. Because two women coming together can amplify their voices. That is very important. That is what I call woman empowerment.
I know. Women supporting women is very, very important.
So true.
Yes. Lastly, Dr. Kasturi, any advice you would like to give to the young, college students or anyone who wants to pursue a career in ophthalmology?
Yeah, I feel pursuing a career in ophthalmology is incredibly rewarding. Why I say at the beginning of this, I mean, when I was talking with you, I have mentioned, eye is not only the gateway to the soul, it is the gateway of diagnosis and treatment of many systemic diseases. And more than that, today you see, today one of the most common age-related disease is cataract. And because of cataract, what you see, so many patients comes with blindness. So if we do ophthalmology, we get an opportunity to reach these people. Even we get an opportunity to reach the unreached, and take care and also decrease the load of avoidable blindness. So we get an opportunity to work for the underdeveloped section of the society and to work for the community, and also to help in the better, vision recovery, and also to give a better quality of vision and a better quality of life to every individual of the society.
Wonderful. That's a wrap for today. Thank you so much, Dr. Kasturi Bhattacharjee, for your valuable time today. You are truly an inspiration. We wish you and your family the very best in life.
Thank you so much, and it's a real pleasure being with you. I also enjoyed the moment, like spending some time with you today. Thank you.
Thank you so much. That's it for today, peeps. Until next time, toodles.